1. How Trump's new law impacts Oregon's Medicaid. An interview with CareOregon's CEO. 2. Republicans' Medicare cuts, a looming healthcare disaster. 1. How Trump's new law impacts Oregon's Medicaid. An interview with CareOregon's CEO. Imagine waking up one morning to find that your access to healthcare has been drastically altered. For many Oregonians, this nightmare scenario is now a harsh reality. Last week, President Trump signed a sweeping domestic policy bill into law, which promises to have far-reaching consequences for the state's Medicaid program. At the forefront of this crisis is Eric Hunter, President and CEO of CareOregon, the state's largest Medicaid provider. In a recent conversation with OPB's Geoff Norcross, Hunter shed light on the devastating impact of the bill on Oregon's healthcare landscape. Hunter described the past week as a whirlwind of uncertainty, as his team waited with bated breath to see the final version of the bill. Despite their worst fears, the outcome was still shocking. "We've seen some dramatic and drastic rollbacks of healthcare that we've really ever seen," Hunter lamented. So, what does this mean for Oregonians on the Oregon Health Plan? The good news is that, for now, nothing will change. Benefits and care will continue uninterrupted. However, this is only a temporary reprieve. The bill's provisions will eventually take effect, and when they do, the consequences will be severe. One of the most contentious aspects of the bill is the requirement that adults between 19 and 64 prove they are working or volunteering 80 hours a month to maintain their Medicaid coverage. This may seem like a reasonable requirement, but the reality is far more complex. As Hunter pointed out, the administrative burden of complying with this requirement will be overwhelming, leading many people to fall off the rolls, not because they don't qualify, but because of the hassle of paperwork and bureaucracy. Another provision of the bill mandates more frequent eligibility checks for Medicaid recipients, which Hunter likened to requiring people to file their taxes twice a year. This may seem like a minor inconvenience, but the reality is that it will lead to people losing coverage, even if they deserve it. When they eventually re-enter the healthcare system, they will be worse off, and the costs to the system will be much higher. The bill also places new restrictions on provider taxes that states use to fund their Medicaid programs. In Oregon, this tax provides about a quarter of the total funding for the Oregon Health Plan. The reduction in this tax will have a devastating impact on the state's ability to fund Medicaid, leading to tough choices about reducing benefits or removing people from the rolls. But here's where it gets controversial. Is there anything in this bill that could be beneficial for CareOregon or the Oregon Health Plan? Hunter was cautious in his response, pointing out that some provisions, such as the federal government's assistance in identifying waste and abuse, could be helpful. However, these benefits are far outweighed by the negative consequences of the bill. As Hunter so eloquently put it, budgets are more than just numbers, they represent intent. The intent behind this bill is clear: to prioritize tax cuts over the healthcare needs of vulnerable populations. This is a short-sighted and mean-spirited approach that will ultimately come back to haunt us. So, how is CareOregon preparing for the inevitable? Hunter emphasized that the current situation in healthcare is already dire, and the bill's provisions will only make things worse. In partnership with the state, CareOregon is working to prepare for the changes ahead, but it's clear that the road ahead will be fraught with challenges. As Hunter pointed out, the bill's provisions will not only affect Medicaid recipients, but also the communities they live in. Projects like the Hawk's Eye Apartments, which provide supportive housing for members, will no longer be possible. This is a devastating blow to the communities that need these services the most. As we move forward, it's essential to ask ourselves, what kind of society do we want to be? One that prioritizes the healthcare needs of its most vulnerable citizens, or one that puts tax cuts above all else? The answer to this question will determine the course of our nation's healthcare system for years to come. We urge you to share your thoughts on this critical issue in the comments below. 2. Republicans' Medicare cuts, a looming healthcare disaster. Brace yourself, Republicans are slashing Medicare, not just Medicaid. Welcome to Trump's Beautiful Disaster, a pop-up newsletter about the Republican tax and spending bill, one of the most impactful pieces of legislation in recent history. Sign up for the newsletter, https://prospect.org/newsletter-sign-up, to stay informed. It's no surprise that the House Freedom Caucus often bends to the will of their leader, Donald Trump. That's exactly what happened at 3:20 a.m. this morning when various assurances, including a potential second reconciliation bill for the 2026 fiscal year, convinced all of them to vote yes on the Republican megabill. This bill aims to take essential resources away from the most vulnerable Americans to provide tax cuts for the wealthiest. Those Freedom Caucus members, along with nearly every other Republican, voted early this morning on the rule governing debate on the bill. Before the final vote, House Minority Leader Hakeem Jeffries delivered an epic speech that has surpassed the 6-hour mark and is still ongoing. It's a kind of talking filibuster, made possible through the tradition of the magic minute granted to the opposition leader. But it's merely delaying the inevitable. Republicans have the votes in the House to pass the Senate bill unchanged, despite several members previously criticizing changes that added more debt, weakened clean energy tax credits, inserted a corrupt deal incentivizing states to make more payment errors in their SNAP program, and deepened cuts to Medicaid, which could devastate the health system. https://prospect.org/health/2025-06-103-hospitals-senate-republicans-senate. But here's where it gets controversial. Republicans didn't just cut Medicaid, they also forced nearly $500 billion in cuts to Medicare, the health program for the elderly. Due to a statutory requirement to automatically impose budget cuts when legislation increases the deficit, the Big Beautiful Bill would trigger automatic sequestration cuts across the board. This has been confirmed by the Congressional Budget Office, CBO, but has been largely absent from the debate over the bill. Medicare is one of the programs that will face these cuts, amounting to $490 billion over the next 10 years, starting in the next fiscal year that begins in October. While many of the safety net cuts in the bill are delayed to help Republicans with their re-election campaigns, https://www.nytimes.com/2025/074/us/tax-cuts-benefit-cuts.html, the Medicare cuts must begin next year. Read more, Trump's Beautiful Disaster, https://prospect.org/topics/E2%-80%-99s-beautiful-disaster. The statutory Pay-As-You-Go, PAYGO, Act of 2010 requires the Office of Management and Budget to keep scorecards that track the cumulative effects of legislation on the budget deficit, based on estimates from the CBO. The Senate version of the Big Beautiful Bill adds roughly $3.3 trillion in debt over the next 10 years. That will have to be made up through automatic sequestration cuts. As CBO confirmed in a letter, https://www.cbo.gov/system/files/2025-05/61423-paygo.pdf, to the top Democrat on the House Budget Committee, Representative Brendan Boyle, Democrat Pennsylvania. OMB's calculation is mandatory, and unless Republicans manage to also pass massive deficit-reducing legislation within this fiscal year, something that is incredibly unlikely to happen, the cuts would follow. Republicans could have waived the inclusion of the Big Beautiful Bill on the PAYGO scorecard, averting the sequestration cuts, but they did not do so. Future legislation could waive the cuts as well, but that has yet to be discussed. Therefore, OMB would be required to issue an order reducing spending by $330 billion by January 2026. Many accounts are exempted from sequestration, including Social Security, and several programs affecting low-income Americans. But Medicare is not. There is a limitation on Medicare cuts of 4% of the program. In fiscal year 2026, that would come out to $45 billion. These cuts would increase with the growth of the program, hitting $75 billion by 2034 according to CBO. The total 10-year cuts would equal $490 billion. President Trump has promised that he would not touch Medicare over the course of his presidency. Of course, he said yesterday that Medicaid wouldn't be touched either. https://www.notice.org/congress/reconciliation-timeline-slipping-Trump, something he was told was untrue by House Republicans. Large Medicare cuts, which would have to be applied across the board, would worsen a hit to the health care system that already projects at least 17 million people losing their insurance coverage. https://www.washingtonpost.com/politics/2025/07//lose-1/4/lease-1/7-million-Americans-would-lose-trump-plan with higher costs. https://aflcio.org/ about//alerts/advocacy/legislative-alerts/higher-costs-and-less-care-families-job-based-health-insurance for people who retain their insurance. Several House Republicans balked at the Medicaid cuts in the bill, including Physician Representative Greg Murphy, Republican North Carolina, and Representative David Valadao, Republican California, whose district has the highest concentration of Medicaid recipients in the country. But both Murphy and Valadao voted for the rule to the Big Beautiful Bill, and quietly set the country on the path to large Medicare cuts. Indeed, these Medicare cuts have barely been part of the overall debate in Congress. Other issues, like capping and cutting state provider taxes, https://x.com/status/1937-2965325394209298, that give them more resources for their Medicaid programs, have dominated the discussion. There are other Medicare cuts in the bill as well, as Jonathan Cohn has pointed out. https://www.thebulwark.com/p//yes-they-are-going-after-Medicare-2-Republicans-big-beautiful-care-vulnerable. In particular, the bill changes the enrollment process for the Medicare Savings Program. https://www.medicarights.org/policy-documents/MSP-enrollment, which helps poor seniors, who also qualify for Medicaid, afford their prescriptions. This could lead to more than 1.3 million poor seniors. https://LDIUPEN-NORTH-EDU Our work research updates research memo loss of subsidized drug coverage and mortality following Medicaid disenrollment translating our findings and implications for Medicaid policy, losing access to this program, incurring thousands of dollars in new costs that they will not be able to afford, and likely leading to them receiving fewer prescriptions and increasing their mortality rates. So Medicare patients will die even without the mandatory sequestration cuts. But if you add that $500 billion slash to the program, you could be talking about serious damage to access to doctors and hospitals, fewer providers able to survive, higher premiums for seniors, and a host of other problems. Healthcare was in trouble even before this bill, and big trouble with the provisions in it. The Medicare cuts put the system on the fast track to oblivion. We want to hear from you. If you're a Hill staffer, policymaker, or subject matter expert with something to say about the big beautiful bill, or if there's something in the legislation you want us to report about, write us at info@prospect.org. David Dayen, https://prospect.org/topics/David-Dayen. David Dayen is the Prospect's executive editor. His work has appeared in The Intercept, The New Republic, HuffPost, The Washington Post, The Los Angeles Times, and more. His most recent book is Monopolized: Life in the Age of Corporate Power. Read more by David Dayen, https://prospect.org/topics/David-Dayen. July 3, 2025. 1.